we all recognise that there are different healthcare needs for the prison population. If you look at not states of literacy, numeracy, mental health, physical health, bloodborne conditions. We talk about the Hep C reservoir is much more significant within the prisoner population. So there are different healthcare needs within the population, and in some ways that can make it easier to deliver healthcare, but the context is not the same. And you know, if you think about mental health needs, you don't normally try to improve someone's mental health and then keep them locked in a room for 20 hours in a day. So, you know, there are challenges about the environment and the broader regime that we're not in control of. So that's why it's been led by the prison service. But also we have a direct interest in the outcome of that work, and then how that then feeds into our ability, if we're going to have these national indicators and standards, about how we can deliver them. You know, running the prison pharmacy that I visited in Swansea is very different to a high street one, as you'd expect. So the other thing that I'm still shocked by, and I really noticed it as a glasses wearer, and I see there are many of us in the room. When I went to Swansea, I couldn't believe that I couldn't see any prisoner who was wearing glasses. And that isn't because the prison population have excellent 20/20 vision all through their life. So the challenge there about there's a need there, and yet you also understand that actually the glasses might not be used just as items to help people to see. And so there's a challenge there about the environment and the regime, but actually that means how do you deal with not just someone's ability to see, and you know, I mean, I could get around, I'd just be stumbling around a bit. I can see metering a bit clearly, and after that it starts to get blurry. But if you're not having regular checks on your eyes, if you're not getting that regular interaction, you know you've got challenges with your eyes, there are other conditions that may not be picked up. So there's a challenge there about that broader health and care provision you can't disassociate from the environment. So that's why all of these things then need to come back together to see how they impact across each other.